Hello, everyone. This is Don Self, and today we're going to have a mini webinar about code G2211. Not enough providers are billing out for it, and I think that's due to a lot of confusion, honestly. First off, Medicare started paying for it back in 2024, and at that time, you could only bill it with an office visit. You could not bill it with an annual wellness visit or any procedures or anything else with it. But that changed in 2025. In 2025, Medicare said you can bill it out with an office visit, immunization administration, annual wellness visit, and select preventive codes. And I'm going to give you a link in a little bit as to which codes those can be. This can be billed out by physicians, nurse practitioners, PAs of any specialty. They don't have to be primary care only. Now, what exactly is a G2211 and what is longitudinal care? It's basically a way for Medicare to reward doctors for taking care of specific problems of the patient. It means, as it says in the description, visit complexity inherent to E&Ms associated with medical care services that serve as a continuing focal point for all needed healthcare services for that particular area, okay, that particular diagnosis. And the ongoing cares must be related to a single serious or a complex condition. And once more, this is an add-on code. You cannot bill it by itself. You sit there and say, okay, give me examples. I'm going to do that in just a moment, by the way. I'll give you some examples right here. It can only be billed out with office visit locations, and you can't bill it out with home visits, skilled nursing home visits, hospital visits, or ER visits. And the provider must be providing continued care. This is not for urgent care clinics to be able to do for a patient coming in one time only. And as I said before, it can be bailed out by any specialty. Say, for instance, you're the primary care provider taking care of the patient's diabetes, and the patient is not seeing an endocrinologist or something. For instance, that would be a perfect example of my wife. Our internal medicine doctor takes care of her diabetes for her, and so therefore she is providing that longitudinal care. Or in a couple of weeks, I'm going to go see my cardiologist, and she takes care of my hypertension. So she is the one that's responsible for that condition that she's taking care of, so she can bill out the G2211. Well, let's say you're the infectious disease physician taking care of the HIV, or you're the pulmonologist and you're the one that's taking care of the patient's COPD, even if I misspelled patient. So keeping all this right here in mind, you want to make sure you don't bill G2211 if you do a procedure like a injection into a joint. You remove impacted cerumen, you destroy a lesion or something like that. You can bill it with the office visit and the AWV, and you can bill it out with the office visit AWV and advanced care planning. And that's going to, make a difference there for you. In 2025, you can use modifier 25, but only if the procedure is on the list that I'm going to give you in a few minutes right here. In fact, at the bottom of the screen, you'll see a link to the preventive codes that can be billed, and that's listed there on your PDF that you can download with this, short video. It can be billed in the same month as chronic care management or remote physiologic monitoring. Cost sharing does apply. Medicare doesn't cover this at 100%, so the patient or their secondary or Medigap would be responsible for the other 20%. Like in my case, Medicare covers the first 80% because I have traditional Medicare, and Mutual of Omaha covers everything after that for me because I have a Medigap plan that I paid for. There's no additional documentation required, and you must be treating a serious or complex condition. And how can you find out more information about this right here? Here's a link right here to go into CMS's Medicare Learning Network. You have also a CMS FAQ page right there. And if you need additional information, you can also visit my website because I have stuff on there as well about it. That's donself.com. Now, if this right here has helped you, great. I hope it has. If you ever need me to, you can reach out to us. Don't forget that I do own Telecare USA. So if you're ever looking for remote patient monitoring, a remote physiologic monitoring company, we're servicing thousands of patients nationwide. And I've started that company about 6.5 years ago. If you want me to, I'll spend an hour and a half with your medical provider and you going over your practice, asking questions, making recommendations. And at the end of that time frame, whatever it is, I'm going to ask you a simple question. Do you think it helped you increase your income by at least 100,000 a year? If you say yes, great, you can pay me my consulting fee of $1,000. That's not a bad return on investment at 100 to 1. But if you don't think it does, then you don't owe me a penny. It's really that simple. So thank you, folks. I hope this has been helpful to you. Visit some of the others. And while you're here on YouTube, please click like and share. Like and subscribe. Like and subscribe. That's how I can get more viewers. And again, thank you for all your support.